Breastfeeding, the first week's second part. How often should you breastfeed? 1. Feed your child on request each 1 to 3 hours during the constantly. 2. Most babies need to breastfeed around 8 to 12 times each day. 3. Your child should nurture consistently for a few feedings. This is called group feedings. 4. Allow your child to breastfeed however long your child is nursing energetically longer on the principal breast until the person appears to be fulfilled. 5. There is compelling reason need to restrict the length of the feedings except if your areolas are sore. 6. Burp your child and afterward offer your other breast. 7. It is okay in the event that your child doesn't take care of at the two breasts during each taking care of. 8. Begin the other breast at the following taking care of. How do you know if my baby is getting enough milk? 1. By multi-week old enough, be certain your child has had something like 6 to 8 wet diapers and 3 to 4 huge, yellow, dingy stools at regular intervals. 2. The pee ought to be pale in variety after the main week. 3. In the event that your child isn't getting sufficient milk, the pee will turn out to be profound yellow in variety and the sum will diminish. 4. In the event that it's difficult to discern whether your child is wet, put a square of tissue on top of the diaper. 5. At the point when your child pees, the bathroom tissue will be wet. 6. Breastfed infants have yellow, shabby diarrheas, frequently with each taking care of. 7. Later on, some breastfed infants could have one stool each week. 8. To check whether your child is putting on sufficient weight, weight checks are accessible at your neighborhood breastfeeding support gatherings or you can consider your medical care supplier's office. Breast care. 1. Wash your hands before breastfeeding. 2. A bath or shower once a day is all you need to keep your nipples clean. 3. Do not use soap or other products when washing your nipples. 4. Use warm water only. 5. Allow your nipples to dry after feeding. How can you avoid sore nipples? Sore nipples are common in the first weeks and are often caused by poor positioning. To avoid sore nipples, follow these guidelines. 1. Make sure your baby's mouth is opened wide, like a yawn, before he or she latches onto your breast. 2. Change your position for breastfeeding. 3. Be sure the baby's mouth is latched deeply to prevent soreness. 4. Rub colostrum or breast milk into your nipple and areola after each feeding. Let air dry. 5. If your nipples are sore and dry or cracking, start breastfeeding with the less sore breast first. 6. Use acetaminophen, such as Ultracet, an anti-inflammatory, such as ibuprofen, or other pain medicine, as prescribed by your healthcare provider, for short-term relief. 7. If your nipples remain sore or are painful, call a lactation consultant. When you can introduce bottles. 1. Try not to present containers until you and your child are okay with breastfeeding. 2. A few moms never use bottles, truth be told. 3. After the initial 3 to about a month, when you and your child have become okay with breastfeeding, containers can be presented. 4. It would be ideal on the off chance that somebody other than you takes care of your child the principal bottle. 5. You could decide to siphon your breasts and utilize this breast milk for an incidental or standard container taking care of. 7. The American Academy of Pediatrics, AAP, suggests elite breast milk taking care of for the initial half year of life, going on with correlative food through the principal year of life and then some. 8. On the off chance that you will be getting back to work, Call a lactation expert 2 to about a month prior to your return to attempt to examine your choices. Are supplements necessary? 1. There is no requirement for supplements in the main weeks for solid, full-term children, except if suggested by your supplier. 2. Stay away from supplements, as they will diminish your milk supply, as a matter of fact. 3. Regular exhausting of the breast is vital to lay out your milk. 4. Stay away from counterfeit areolas, pacifiers, and containers for the initial month, as they could diminish your milk supply. 5. Your child controls your milk supply by taking care of frequently. 6. As your child develops, there will be times when the person breastfeeds more than expected, and this will expand your milk supply.